Hello everyone. It's my hope that you're still doing well and I'm good too. So, welcome back to our today's discussion on acute gastritis. In this section, we are going to look at the investigations that you're supposed to do once suspected to be having acute gastritis. And we also look at the treatment or management of acute gastritis. So let us start with the investigations. So what are the investigations that you are supposed to do once suspected to be having acute gastritis? One, there is what we call serological tests. And in this test, we are simply looking at the H. pylori antigen and H. pylori antibody. Remember I talked about this when we were talking about peptic ulcer disease. We said that in H. pylori antigen test, a sample of stool will be taken for investigation. But in the H. pylori antigen test, a sample from your blood will be taken for investigation. So this is one of the most important investigations that will be done once suspected to be having acute gastritis. You can also do some other investigations like polymogram. You can also do what we call endoscopy. And in the endoscopy, you'll find that some epithelial hemorrhages are found, some epithelial hemorrhages and some erosions. So endoscopy is another important investigation for somebody suspected to be having acute gastritis. So those are some of the investigations that are done in acute gastritis. Now let us look at the treatment. How do you treat acute gastritis? So in most cases, you'll find that acute gastritis is self-limiting. So it will dissolve by itself, even without medication. But at times, you'll find that you are supposed to give some medication, whereby you can give antacids like the magnesium trisilicate or what we call Actor. So you can give antacids like Actor. You can also give drugs like H2 receptor antagonists like ranitidine, cimetidine, among others. You can also give proton pump inhibitors. And one thing you have to know is that proton pump inhibitors are more superior to H2 receptor antagonists. So you can give proton pump inhibitors like omeprazole, esomeprazole, among others. But in some cases, you'll find that the condition is somehow severe. So in severe cases, you can consider IV drugs. You can give IV ranitidine, you can give IV omeprazole, etc. So that is the medical treatment of acute gastritis. But one thing you have to notice that in addition to this medical treatment, there are those things that we have seen can cause acute gastritis, and we as human beings can still prevent. Remember, we have alcohol intake. You can still avoid alcohol intake, excessive alcohol intake. You can still take on your diet. Remember that we have said spicy diets, poisoning poisoned food. So you can still take on your diet. Ensure that you are not risking yourself. You can also avoid some drugs like the Hennessy. So what I'm trying to say is that in addition to medical treatment, you can also avoid those things that can risk or can increase the risk of developing acute gastritis. So that marks the end of our today's discussion on acute gastritis. So let us meet in the next video, whereby we'll be discussing on chronic gastritis. Remember, we have said that gastritis is classified into two. We have the we have the acute gastritis, and that one we've discussed about. So next time we'll be discussing on the chronic gastritis. So up to this point, it's my hope that you have learned something, and you will keep learning as much as you'll keep watching our videos. So to those of you that have not yet subscribed, I request you to kindly subscribe, like, and share our videos. And those of you that have subscribed. I really appreciate. May God bless you. So it's my humble request that if you have subscribed, kindly keep sharing so that we can reach um, a larger population. So guys, have a blessed day and may God bless you all. Thank you for watching.